Do you envisage imposing mandatory COVID jabs?
No. The only place we've said that there will be mandatory requirement, that's in certain settings such as the NHS and social care. But if you're talking about mandatory jabs as some countries in Europe have announced, no. In fact, I'd go even further. I think it's unethical. And also, I think that at a practical level, having some kind of universal mandate for vaccination doesn't work. Getting vaccinated needs to be a positive decision. We're lucky in this country. We have a very high vaccination rate. There's still some vaccine hesitancy out there. But I think you need to work with people, persuade them, and help them to understand why it's good for them and their loved ones and the people around them.
Well, I said right at the beginning of this pandemic that I think, or as soon as we were really talking about vaccination seriously, that I didn't want us to have a society and a culture where we force people to get vaccinated. I don't think that's ever been the way we do things in this country. And actually, Dave, we've been able to achieve through the voluntarism of the British people, through their incredible public spiritedness, willingness to roll up their sleeves and get vaccinated, huge numbers, huge proportions of our population. I think that there is going to come a point if we can show that the vaccines are capable of holding of Omicron, and that's the key thing that I think that we need to test. Well, I do think that we're going to have a conversation about ways in which we deal with this pandemic, because I want to be absolutely clear with you. I don't believe we can keep going indefinitely with non-pharmaceutical interventions. I mean restrictions on people's way of life, where just because a substantial proportion of the population still sadly has not got vaccinated. And I think we're going to need to have a national conversation about the way forward and the other things that we can do to protect those who are hard to reach, who haven't got vaccinated for one reason or another, who may have medical reasons why they can't get vaccinated, other ways of protecting them. But that is a stage that I think we will come to if and when we establish, as I hope that we will, that the booster is effective against Omicron, and the booster is capable of holding Omicron, getting us back into that equilibrium that the double jabs got us into with Delta, if you follow me. So it's at that moment that I think we will have to talk seriously about moving on from the way from thinking about further NPIs and thinking about other ways in which we protect people.